Hello, welcome to my channel and to another episode of Malezi Friday. My name is Jennifer Munanie and I am the founder of Lea Lactation. In today's episode, I want us to talk about breastfeeding in the first few days, particularly in the first week. A lot happens after you've given birth. You and your baby are recovering from the process of labor and birth. You're learning to breastfeed, your baby is also learning to latch, and they are getting used to life outside the womb. In this video, we'll look at what happens in terms of breastfeeding day by day. Let's begin with day 1 of breastfeeding. I talked about this in a previous video, so I'll only be doing an overview of this. Essentially, what happens in the first day of breastfeeding, particularly in the first hour or the golden hour, depends on how you labor and birth, because labor, birth, and postpartum care impact breastfeeding. I also talked about this in my previous video. Please check it out. In the first hour, you want to do lots of skin-to-skin contact, which results in the breast crawl that leads to the first breastfeed. It's important that this process is uninterrupted. In that first breastfeed, your baby is feeding on colostrum, which is that thick, sticky, yellow breast milk. In this first day, you will produce colostrum in very small amounts, but it is enough for your baby. Averagely, babies take about 5 to 7 ml per feed in the first day. The colostrum is easily digested by your baby's body, so soon they'll need to feed again. It's important that you latch and breastfeed your baby as frequently as possible. This is the day that you learn and practice how to latch and breastfeed your baby. Remember, latching and breastfeeding should not be painful. If you're still in your birth center or the hospital that you've delivered in, you can ask the lactation consultant there to support you with this. Your baby will have their first pee and first stool in this day. That first stool is very important because it contains bile, preventing its buildup in your baby's body, reducing the risk of jaundice. After the first breastfeed, your baby falls into a deep sleep. It's important to keep waking them up to breastfeed. Moving on to day 2 of breastfeeding. In the second day of breastfeeding, your baby is more alert compared to the first day. They may experience what is called the secondary syndrome, where the reality of waking up to a world that is very bright, loud, and where nutrition is not on constant supply, like it was while they were in the womb, hits them, and they may get very fussy. What to do in this day is do as much skin-to-skin contact as possible, cuddle them, and breastfeed as frequently as possible. You may start experiencing soreness from the process of labor and birth. At this point, you've also been breastfeeding for 24 hours, so your nipples and breast may feel tender and sore. Remember, they should not be painful. If you experience pain and you're still in the hospital or birth center, ask your lactation consultant to support you with this. There's usually a surge of hormones in day 2, and this may cause you to feel disoriented or feel more emotional than usual. In terms of diaper output, the expectation is at least 2 wet diapers and 2 dirty diapers or 2 stools in day 2 of breastfeeding. When your baby is weighed on this day, they will likely have lost weight, which is normal. Babies do lose weight after birth, and the acceptable weight loss is 7 to 10% of their birth weight. If your baby loses more than 10% of their birth weight, they will need intervention. The most important thing on day 2 of breastfeeding is to take it slow as you recover from the process of labor and birth, as you learn how to breastfeed, and to trust your instincts. Moving on to day 3 of breastfeeding. The third day of breastfeeding is the most challenging for moms, mostly because there is an increased surge of hormones, so you may find yourself crying or feeling low. Because of this surge of hormones, you'll also experience a dramatic increase in the breast milk volume that you're producing, so your breast will feel full. It's important that you breastfeed as frequently as possible to prevent engorgement. Thankfully, your baby's stomach capacity has doubled at this point, so they are able to take in more breast milk. If you experience nipple soreness, you can apply some nipple cream or nipple butter. Sometimes the soreness may be too much, such that you want a break from directly nursing your baby at the breast. You can express into a spoon or medicine cup and feed your baby. Day 4 of breastfeeding comes with further risk of engorgement because of the increased breast milk volume. Please do not introduce a breast pump at this point. What this will do is it will send the wrong message to your brain. Remember, breastfeeding or breast milk production is a demand and supply process. If you introduce a breast pump at this point, you are basically telling your brain that you need more breast milk, and more breast milk will be produced. Dealing with more breast milk volume when you're already dealing with engorgement is not a good position to be in. The best way to deal with engorgement is by breastfeeding your baby as frequently as possible without further stimulation of your breast, creating more demand using a breast pump. There are different types of breast engorgement. If your breasts feel like your cheek, then you are okay. If your breasts feel like your nose, then you're moderately engorged. If your breasts feel like your forehead, then you're severely engorged and you need intervention from your lactation consultant before things get worse. There are different ways to deal with moderate or mild breast engorgement. The first is reverse pressure softening. You gently massage the different sections of your breast towards the armpits or the clavicle, or apply gentle pressure all around your breasts. The second is to hand express a little, either into a cup or into a spoon, to relieve the engorgement. Remember, you do not want to express too much such that you create more demand. Third, you can use breast compresses, either warm or cold. Warm when your baby is feeding to allow for the letdown, and cold when your baby is not feeding. Breast therapy packs are very effective for the warm or cold compresses. You can either use them warm, especially when your baby is feeding, or cold when your baby is not feeding. For the warm compress, you can throw them into the microwave for a few minutes. For the cold compress, you can have them in the fridge for a few minutes. The breast therapy packs are designed to cover your entire breast at a go and come with a cover to protect your breast skin from the heat or cold. These are available at Lea Lactation. I'll link them in this video. A breast milk collector also comes in handy when you're dealing with breast engorgement. Remember, with engorgement, you do not want to create more demand, leading to more breast milk supply to deal with. You want to create as low suction as possible. This is strong suction. This is low suction. These collectors are also available at Lea Lactation. I'll link them in this video. Finally, a manual breast pump. Even though I mentioned not introducing breast pumps at this point so that you do not create more demand leading to more breast milk supply to deal with, yet you are already engorged, a manual breast pump can come in handy. Just remember to use it at the lowest suction possible. During day 4 of breastfeeding, your breast milk also transitions from colostrum, which is that thick, sticky, concentrated yellow breast milk, to transitional milk, which is not as concentrated yellow as colostrum, but it is also not as white as mature milk. Moving on to day 5 of breastfeeding. The 5th day of breastfeeding is mostly about getting to know your baby better, getting to know their patterns, that is, their feeding patterns, their feeding cues, whether it's the hunger cues or the satiety cues. At this point, your baby is likely cluster feeding, which is feeding after very short durations. As annoying and frustrating as it is, please bear with them and breastfeed as frequently as possible. During day 5 of breastfeeding, you may also notice that your breast milk starts to leak because of the increased production at this point. You can opt to use nursing pads to prevent the breast milk soaking into your clothes, either the disposable ones or reusable nursing pads. The reusable ones are a much better option. A breast milk collector is also another option. Remember, you do not want to create more demand at this point, so do not use strong suction when using a collector. Breast milk collection shells are also another option for collecting the leaking breast milk. You have them sitting in your bra and inactively collect the leaking breast milk without stimulating your breasts. These are available at Lea Lactation. I'll also link them in this video. Finally, you can use a cup to collect the leaking breast milk from one breast as you breastfeed from the other. These cups are also available at Lea Lactation. I'll link them in this video. During day 5 of breastfeeding, you may also feel your letdown. In most cases, they're usually strong and you may need to pause and breathe through them, but with time they will fade away. Moving on to day 6 and 7 of breastfeeding. By this time, your baby is starting to regain weight, though they have another week to do so. The recommendation is that your baby regains their birth weight by 2 weeks after birth. Around this time, you're also getting the hang of things. You're getting to learn your baby more. We're getting to learn how frequently they are breastfeeding, how frequently they are peeing or pooping, how long their nap time is, how long they sleep, their feeding cues, their hunger cues, their satiety cues, and so much more about your baby. I know this is just an overview of what happens in that first week of breastfeeding because there is a lot that is happening. So please let me know what I missed out on, what your experience was in that first week, and what you'd like other moms to know about this first week of breastfeeding. I hope you found this video useful. In case of any questions or comments, please let me know in the comment section below. I'll be sure to respond to them. Thank you for being here. I'll see you in the next episode of Malaysia Friday next week.